Today we're going to talk about the app that helps you keep track of all of the cancer screenings that you should be doing in order to make sure that you stay healthy. It's the USPSTF app, and we're going to get started with it right now. Hello, I am Dr. Scott Bland. I am a family physician with a goal of helping you understand the medical information that really allows you to make the decisions that line up with your priorities and values. Okay, everyone, what we're going to do is we're going to go ahead and click the App Store here. We'll go to the search section, USPSTF. There we go. That is the U.S. Prevention Task Force. And this is the app that you're going to want to get right here. I've already downloaded it, so let's go ahead and get into it and check some of the features that exist and how this can help you screen for your health. Okay, I like to click the search bar down here at the bottom. This is one of the things that I'll actually use to help keep myself track when I'm seeing patients is go ahead and put their age in there. If you happen to think I'm younger than 40, that's super nice of you. I am not, but we'll go ahead and put down 195 pounds. That maybe sounds about right. If you thought I was lighter than that, again, thank you very much. So you put in your demographics here. I do not use tobacco, and there we go. Okay. So we've got all the different screening things that are recommended here. Now, one of the important things to remember when you look at this is that not all of these require a test or imaging, x-rays, MRIs, that sort of stuff. But a lot of these are just triggers that mean that your physician should be evaluating your risk factors for some of these areas. And maybe they don't apply to you, but they're things that you kind of need to look through. So here you'll see that someone needs to make sure I'm not smoking, that I need to have a talk and make sure I've had an HIV test at some point. It's reasonable to have a discussion with me about diabetes and check for my risk factors there. Talk to me about being healthy and making sure I'm staying physically active. Talk to me about a hepatitis C screening, and I think that's a reasonable thing to do as well. Talk to me about my TB risks. Talk to me about double checking if I am at risk for needing to be on a statin or cholesterol medication, all sorts of things there. So there's a lot of interesting stuff there. Now, if you're a 40-year-old male who's moderately overweight there, if you see the 26.4 BMI at the top, there aren't a ton of things to go on. But if you start getting older, you'll find that there's some different things here. So if I make myself a 50-year-old female and say that I smoke, now a whole bunch of things change for me, right? Now there's cervical cancer screenings. Now there's colorectal screenings because I'm over 50 in this hypothetical person. Then you're talking about like BRCA screenings, breast cancer screenings, all sorts of things that get added into here, as well as now osteoporosis risk screenings. Lots of things to do there. Now, if you don't want to chase it just solely off of your own demographics and you want to chase some of this information based off topics or what's going on, you can actually go in here and you can look up the very specific issue that you want to look up. So if you want to say, hey, when should I be checking for colon or cervical cancer screening? You can just click right there and you can get some of the advice from the USPSTF about when to get checked for particular diseases or particular illnesses. I think all this is something you need to check up on in case your physician doesn't catch it. Maybe you're somebody who's been avoiding physicians and this is a good thing to let you know what you need, so it can be a trigger for you to go back and speak to your physician. But this is a great way for you to keep track of your own health screenings and make sure that you are aware of the things that you should be doing and the things you should be checking into to make sure that you stay healthy. Remember, you are the person who's responsible for your health, and this is a great idea for you to do. This is the USPSTF app, okay?